I know that might be a bit awkward for medical practitioners to discuss, but it's also really important and it could be life-saving and life-changing.
Before we get into it, I'd like to respectfully acknowledge that this video series was filmed on the stolen lands of the Wurundjeri people of the Greater Kulin Nation. Just a heads up, the following video series contains content that may be distressing for some. Welcome back to Getting Into It. This video is about curious conversations. My name is Dr. Lena Molnar. I use she, her pronouns, and I'm a gender-based violence prevention expert.
My name is Hetty McCullough. I use they, them pronouns, and I'm an expert in sexual and reproductive health promotion.
So what's a curious conversation? Are we having one right now?
A curious conversation is making sure that you're approaching the topic of sex and sexuality and pleasure in an open way that doesn't bring your own assumptions and biases to the conversation, and you're letting your client or patient lead the conversation as well and adjusting the conversation accordingly.
Should practitioners be worried about having these kinds of conversations?
It can be awkward to bring up these conversations, and it can be difficult to bring it up in a way that you think is appropriate for every single patient and client that you have. That's not a reason to not bring it up, because it's more detrimental to ignore it and bypass the topic completely. When you do bring up the topic, you can adjust it based on the person's comfort level.
How can I check myself in my awkwardness so that I can adjust the language that I'm using, or know that there was a boundary there and we can rephrase in a comfortable way for the person that I'm working with?
Yeah, definitely. I think really being open and upfront about it and just asking simple questions about, do you feel comfortable talking about sex at the moment? Is this something of your health and well-being that you would like to discuss today? If we do talk about this further, is there anything else you'd like to avoid? Or if there's any terminology you'd like to avoid, or any topics that you'd like to just focus on?
I want to talk about sex. I want to have the opportunity to talk about it, including with practitioners. And I want them to ask me what kind of sex I want to be having. And is there anything holding me back from that a practitioner could suggest or support me with?
Medical practitioners can really make a difference just by listening, just by helping, just by modeling consent, even providing this information on what is and isn't consent. I know that might be a bit awkward for medical practitioners to discuss, but it's also really important and it could be life-saving and life-changing. The fact that in my 29 years of life, not once has a medical or health professional mentioned consent or pleasure to me, that's not really good enough, especially when we have such high rates of sexual violence.
Ask a billion questions and I will tell you, no, I don't want to talk about that. Yes, please ask me more about that specific area. I think checking in to see if, a person's comfortable. I've had so many experiences where medical practitioners will just breeze past traumatic questions and ask the most personal stuff like it's nothing because, it's their day-to-day life. To that person, it's a big deal. It's traumatic, it's stressful. So I think just asking and checking in is probably one of the biggest things.
It's really that curiosity in the conversation that seems to be emphasized in all those examples that you're giving me. Just being curious, not being too intrusive.
Yeah.
These are topics that folks may be super confident to talk about and waiting to talk about, really excited to talk about. But for other folks, this might be the first time anyone's talked to them about it.
Exactly. And it might need a longer term of building that relationship and trust for a person to open up to you about it. And that's totally fine. But showing them that you are a person that can talk about it is really the foundational thing.
Yeah. And part of that practice might be letting them know that we can begin this conversation. You can let me know if we're getting into something that's a bit rough or a bit spicy or sore. And at any time, there's consent in having the conversation as well.
100%. And reinforcing that the answers that the patient or client provides aren't going to change the medical care that they're going to receive. And that no matter what their answer is, you're there to openly and non-judgmentally accept it and just incorporate that into your care plan.
I have been sexually assaulted a few times in my life, and sort of that taking away power was a really hard thing to go through, especially at such a young age, to the point where if I was with a partner it was really difficult for me to be intimate. But being with a partner who understands consent, understands informed consent, like, you know, wanting me to be fully into it before anything could ever happen, really helped me be able to explore not only pleasure with them, but pleasure with myself. Just being able to explore your own body and being able to set those boundaries with your partner is really important, because then you can both have like an enthusiastic and enjoyable time.
I also went to workshops, face-to-face workshops, to learn more about consent, and then seek the help of sexologists as well, just to sort of be a little private guidance as well. I learned about the traffic light system. So green is that you're having a good time, it feels good, keep going. You might say orange when it's not feeling quite right, you might want to adjust. And then red is just a hard stop. That's an easy thing to teach someone that you're with. I don't think it's a vibe killer at all. I think it leads to better sex, because you don't want to be continuing with something if it doesn't feel right.
As a neurodivergent person, I feel less anxiety and I'm able to be more in the moment if I have a bit of an idea about how things are going to go down. That actually allows me to be more present and experience more pleasure. So having conversations with a potential sexual partner is an opportunity to tell them about like any sensory sensitivities that they would need to keep in mind. I didn't like come to this process through being informed by a healthcare provider.
I think a good thing allied health professionals could start with is just learning about disability and all the intersections that can exist with being a disabled person, a queer person, and any other kind of marginalization someone might identify with. It all impacts us and it's all important. It's also important to consider the stigma that exists around sex and disability. So if you can work on destigmatizing that and looking at your internalized ableism, that's already a great step. And I guess just understanding that, yeah, these conversations might be awkward, but don't just avoid them with disabled people because you think we don't need it.
The language around sexual and reproductive health is not very accessible most of the time. So being adaptive and flexible and ask folks how they talk about their own bodies, how they talk about their genitals, but also what they enjoy and what is useful for them.
Yeah, definitely. And alongside that, that includes also making sure that the language that you're using affirms the person's gender identity as well. And that's something that you should be checking in with at the very beginning of the session. And it's something that demonstrates respect and trust building as well within that relationship. And that can also make it more accessible to access sexual and reproductive health services.
If anything you have heard in this video has brought up distressing feelings, please call 1-800-RESPECT. For more information or other resources, feel free to visit the Women with Disabilities Victoria website at wdv.org.au.